Greetings and welcome to Measuring Wellbeing Tools and Resources for Your Company Wellness Plan. During the presentation, all participants will be in a listen-only mode. As a reminder, this conference is being recorded Wednesday, October 9th, 2019. Now I'd like to turn it over to Ms. Gina Bryant. Please go ahead.
Thank you. Welcome, everyone. Thank you for joining us today. This webinar is being brought to you by the best and brightest companies to work for. This program will be recorded and will be available to view starting next week. It'll be on the Best and Brightest Companies to Work For website. In order to receive your SHRM or HRCI credit, you must complete the SurveyMonkey evaluation that will be emailed to you later on today. This is the only way you will receive your certificate with the codes for continuing education. So we're going to get started. Today's program is Measuring Wellbeing, Tools and Resources for Your Company Wellness Plan. Our presenter today is Mari Ryan. Mari is the CEO and founder of AdvancingWellness. Mari has been creating healthier businesses and impacting the lives of employees through her consulting work and her speaking engagements on worksite well-being. Not only is Mari an expert in worksite well-being, she is also the author of The Thriving Hive, How People-Centric Organizations Ignite Engagement and Fuel Results. I'm going to now turn over this webinar to our presenter, Mari Ryan. Go ahead, Mari.
Thanks so much, Gina. Thanks for the invitation to be here. Welcome, everyone. It's my pleasure to share with you this information today on this important topic about measuring well-being. Let's go to the next slide. I hope that you'll agree with me on when we look at this statement. To achieve our goals, we must measure progress. This is an important statement because if any of you have worked in business for very long, you know that we have to measure a lot of things in business. Next slide. So you probably have many different ways that you're looking at measuring business elements and key performance indicators and a variety of different things in your business. We're going to take a moment now, and I'm going to ask you to tell us a little bit about some of the ways in which you do make measurements in your business. So let's go to the next slide. And I'm going to ask you to just, instead of using the instructions on the bottom of the screen, I'm going to ask you just to use the chat box. If you look for the little bubble in the lower left corner of your window, you should see the ability to be able to chat with us. Tell me, what are the key metrics that you use to measure your business? So in whatever particular role you happen to be in your organization, there must be some sort of metrics or key performance indicators or objectives and key results that you use. So take a moment and just go ahead and type those in. And let's just see a little bit about some of the types of measurement tools or measurements that you're using in your business. And Gina, as we start to get some of those in, why don't you start to share some of those with us?
Okay, Mari. So far we have revenue, gross profit margin, net profit, number of leads. We also have standout engagement polls. How about employee turnover?
Yeah. Thanks for sharing those. If you want to just continue to type those in. So far we've heard revenue, gross profit margin, net profit, leads, engagement, turnover. So depending on the kind of role you're in, will determine what your key metrics are and probably how you're measured in your role. When we're thinking about wellness programs, and what we'll explore today when we look at wellness and well-being programs, and I will use those two terms interchangeably, is we'll look at some of the different ways that you can consider business metrics to be able to measure the impact and outcomes of your wellness and well-being programs. Let's go to the next slide. Measuring what matters is an important element in any aspect of business. And as you've indicated with some of these types of metrics, we have a lot of different things that we can measure. This was a book that I highly recommend that was available and has been very popular over the last couple of years. And this uses the concept of objectives and key results. Objectives and key results were actually invented by Andy Grove when he was the CEO at Intel a number of years ago. The objectives are really the definition of what the direction is of where you're headed and what it is you want to accomplish. Whereas key results are the measure of did I do that or did I not do that, and how am I going to get that done? This is a really interesting book to be able to help you understand how many large organizations and a lot of top Silicon Valley type businesses use these OKRs to measure their businesses today. It's a good, quick read. I would highly recommend it. It's one of the things I recommend when thinking about how we read outside of our own fields and look for different ways in which we can be leveraging business concepts such as this. Next slide, please. Another key metric that we often use in business, and some consider, and if you find some Harvard Business Review articles on this, that there really is only one number to manage in business, and that would be Net Promoter Score. So if we take a look at the next slide, Net Promoter Score is really a metric that is used to determine how many of the, in this case, let's say it's customers, are promoters. They typically answer the question, how willing would you be to recommend this product or service to your friend or colleague? Those that are promoters are the supporters of your brand. Those that are the detractors are the ones who are possibly not saying good things about your brand, whereas the passives are just neutral. And this is an important metric that's been used in customer rating type metrics for a long time. And increasingly, it is starting to be used with employee engagement as to whether your employees would be willing to recommend this as a place to work to their friends or colleagues. And this can be something that can be translated into the use for a well-being program as well. You know, how satisfied are people with the program that they're participating in and the way that it's being administered. Next slide, please. But oftentimes when we think about metrics, we're thinking about them only in the context of money. And oftentimes when we look at even just some of the elements of the metrics that you shared earlier, revenue, gross profit margin, net profit, leads, all of those just translate into money. So we are often measuring elements in this way. But there are many other aspects besides money that we want to consider, especially when we're thinking about our well-being programs. Next slide, please. When we think about prosperity, when we think about these in the terms of metrics, we have for a long time measured prosperity typically just in financial measures. Gross domestic product is most often the one that is used globally to be able to measure the progress and how a company and an entity, in this case a country even, is managing prosperity. So we look at these both political, economic elements really from just the financial perspective. And yet this research, which comes from the PricewaterhouseCoopers annual CEO survey, indicates that countries are increasingly looking for other ways to be able to measure prosperity. And increasingly, these are looking through metrics that would be quality of life indices. So in essence, the well-being, not just the financial aspects such as gross domestic product. And actually, I just recently posted another article from Harvard Business Review on this topic on my LinkedIn profile. So if you want to find that article, you can just follow me on LinkedIn. There are many increasing interests in using quality of life metrics rather than just financial metrics. So let's go to the next slide, please. So why measure? So what we want to be able to understand is, especially in the context of our well-being programs, is we have to understand what's the important aspect that we're going to be asked to be accountable for. So let's go to the next slide and let's explore some of the reasons why we measure well-being programs. The first is focus. So anytime we are working on something in the context of business, we have goals, we have objectives, and we have to stay focused on those to be able to avoid distractions. All too often, I see in wellness programs that some new initiative starts to get undertaken. And when I ask, well, why did you do that? It didn't appear in your goals or objectives. Oh, well, it's my brother-in-law's sister's friend who now has this service available, and we decided to go and do that. Well, that's a distraction that may not be consistent with what your goals and objectives are. So we always want to be making sure that we're staying focused. Next slide, please. Accountability is perhaps one of the most important aspects of this. And this is to hold yourself accountable to achieving your goals, but also to the extent to which you become accountable within your organization. Every program, every initiative that takes place in an organization requires resources and people to be able to make that happen. And we are accountable for being able to utilize and manage those resources in an appropriate way. Next slide. Credibility. This is an essential element for well-being programs because for your program to be credible, it has to have impact. And you can't have impact if you can't measure it. So it's an essential piece to be able to have credibility for your program. Next slide. Let's step back and define well-being because this will help us make sure that we're all on the same page with understanding how this fits in the context of your work. Next slide. This definition is a broad one, and it says well-being includes the presence of positive emotions and moods, for example, contentment, happiness, the absence of negative emotions, for example, depression and anxiety, and satisfaction with life, fulfillment, and positive functioning. Now, this is an example of one of several types of definitions that I present when I'm working with clients so that we always come to a clear definition about what we mean by well-being. Now, you might look at this and say, well, this seems very mentally health-focused, which is one approach that you can take to this. You might see it as not including a number of other elements. But I'm going to share with you a couple of these definitions so that you can see how we can put them in context and be able to make sure, again, you've got the right definition that's going to work for your organization. Next slide. This list of dimensions is a broader viewpoint of well-being and one that I think is more relevant to the work that many of you are doing today in the workplaces. And you'll see that includes things like physical, economic, or financial well-being, social, development and activity, emotional, psychological, life satisfaction, and all kinds of different elements that really touch on who we are as individuals. Because we are very multidimensional, we want to make sure that we're offering programs that are going to meet the very different needs of populations within your workplace. So I consider this to be a more inclusive element that could be something that, again, I encourage you to make sure you're defining it for what's right in your organization that's going to fit for the way you're developing and implementing your programs. Next slide, please. So let's ask the question, another question here. Again, let's use the chat box in the lower left corner. Tell us a little bit about how are you measuring well-being in your organization. I asked this recently at another venue where I was offering a speaking engagement and had very interesting responses to this. So I'm curious to see the elements that you're using and the definitions you're using of measuring well-being in your workplace. And Gina, as those start to come through, if you could share a few of those with us.
Absolutely.
So go ahead and just type that into the chat box in the lower left corner of your screen.
One of our participants says that they conduct quarterly reviews where they encourage employee feedback, but do not feel that I truly am doing a good job of measuring their well-being.
Okay. Thanks for sharing that. So feedback is a very important element of this, and as we go through this today, we'll talk about that. And if for some reason your question doesn't get answered, we can actually address that in a little bit more detail. But making sure that we are indeed not only finding out what people want to do and what their interests are, but that we have solid metrics to be able to know over time whether or not their well-being is actually improving. And I can talk about a couple of different examples of that, some of the elements that I use in survey questions as an example, or in focus group questions.
Hey, Mari, we had a few more.
Okay.
We had annual employee engagement survey. Another one uses the engagement pulse and participation in their wellness programs.
Okay, great. So participation is a very common metric that we use. It does tell us a little bit about the extent to which people are utilizing the resources that you're making available. The engagement surveys, and I love hearing about people using pulse surveys. So those are another great way that you can just go out and at a given point in time just really quickly get a sense of how people are feeling about particular things. So those are all great to be able to use. Let's go to our next slide. It's very important for us to be able to link employee well-being and business results. Having spent my entire career in business and now the last decade or more in the field of well-being, I feel like this is a place that we often forget to make connections, and sometimes we're not tied into the strategic viewpoint of an organization so that we can really be linking employee well-being and business results. So let's explore this in detail. Next slide, please. Companies that build a culture of health by focusing on the well-being and safety of their workforce have been shown to yield greater value for their investors. I'm really excited about research that's coming out in this area over the last few years, where we're really starting to be able to see the impact to the bottom line and how this can be measured against peer groups. So let's explore a couple of these research elements in detail. Next slide. This research came out earlier this year from one of the top researchers in our field, Ron Getzel. And in this research, he was looking at the stock performance of American companies who have invested in a culture of health. And they very clearly defined what a high internal culture of health metric would be. And in doing that, they then compared those organizations against a Standard & Poor's benchmark. And you can see there's significant difference, 115% return versus a 69% against the benchmark. So clearly there are those organizations that are focusing on culture of health really are making impact to their bottom line as a result. Next slide. This was one of the original research projects on this topic, and this was by Ray Fabius, where they looked at a group of award winners, and they looked at the link between workforce health and safety and health of the bottom line. So these award winners, or this portfolio of award winners, were publicly traded companies, so it could be measured against, again, the Standard & Poor's 500. And here you'll see, again, there's significant difference, close to $20,000 return versus the close to $10,000 return, so almost double. And again, this early work that he had done on this has continued to really show us that there is impact to the bottom line when companies focus on health and safety. Next slide, please. This one also more recent. This was the stock performance of another group of winners. This was the C. Everett Koop Award winners. Again, this research by Ron Getzel. This, again, was just looking at publicly traded companies who've received this award and the comparison of those, the cumulative stock performance of those award winners versus the S&P 500. Consistent, every one of these shows consistent outperformance by those companies that are focusing on the culture of health and well-being in their workplace. These slides can be very helpful for you if you're trying to build a business case and to get budget or additional resources for your program. Let me show you one last one. Next slide, please. This was from a research done with the Health Enhancement Research Organization. Hopefully many of you are familiar with the Hero Health. Jessica Grossmeyer's the researcher on this, where they looked at organizations that respond to the Hero Scorecard, and I'll talk about the Hero Scorecard. It's a best practice scorecard. And again, these would have been the publicly traded companies and their stock performance against the S&P 500. What I love about these 4 slides is they show you consistency across the different groups that were measured. So these were not the same companies that were being measured. And in every case, there is the high scoring best performance companies who are scoring high on the Hero Scorecard are outperforming their stock market index. Next slide, please. So let's also not forget that there may be an elephant in the room. Next slide, please. And I think you probably know where I'm going with the elephant in the room. And this is a topic that almost always comes up when we talk about measuring well-being. And that's return on investment. Next slide, please. So return on investment is something we hear a lot about, in particular with regard to wellness programs. Wellness programs, when I first joined this industry over a dozen years ago, were really intended, the goal of wellness programs was to reduce healthcare costs. And yet we all know, if you've spent any time looking at healthcare costs, there's many elements of healthcare costs that are just things you just cannot control for. And as a result, it makes it very difficult to be able to show a direct causation between wellness programs and changes in healthcare costs. And over the last same decade, we've also seen a lot of changes in healthcare plan designs, which have moved a lot of burden from the employer to the employee. While it reduced costs for the employer, it actually doesn't change the total cost of the health care. Next slide, please. So return on investment is once again a financial measure. It measures the gain or loss generated on an investment relative to the amount of money invested. So it's usually expressed as a percentage, typically used, it can be used for personal financial decisions, for company financial decisions, compare profitability, or to compare an efficiency of an investment. And certainly when organizations are putting money into wellness programs, it's an investment. You're making an investment, that money could be used elsewhere. But it's hard when we're comparing this just to the aspect of healthcare cost savings as the only measure by which we would be able to determine an ROI. Next slide, please. And ROI is intended to be a tangible return. It's intended to show profit, to be able to show how this investment is a better use of money than another investment. Next slide, please. So here's what it's typically measuring and why this is hard to measure against healthcare costs, because there's a lot of variables that are going to impact healthcare costs. We know that family health experience and lifestyle choices can have impact. Medical cost inflation, which runs anywhere between 3 and 6% per year. Local market medical dynamics can have impact. And catastrophic events can always can really throw things out of whack without any control over how those elements happen. Next slide, please. So what we'd really prefer to do is think about value on investment. So where's the value that we're receiving as a result of the way that the resources and money are being used? Next slide, please. So here's how we define value on investment. So it's intangible assets that contribute heavily to an organization's performance. And these intangible assets may include knowledge, processes, organizational structure, the ability to collaborate, many things that while you can feel it and sense it in a workplace, that sometimes they might be a little harder to measure. We know that ROI is a measure of tangible benefits of a project or an activity, but VOI is the measure of the intangible benefits of a project or an activity. And VOI includes ROI. So this is probably a much better metric. Next slide, please. So when we're looking at value beyond ROI, we want to think about some of the non-health factors that we can potentially look at. Social cohesion of work teams. Again, you can feel it in your workplace when people are collaborating and working together. Increased productivity. Now, in some organizations, that's very easy to measure. In others, it's not quite so easy to measure. Turnover, as someone indicated earlier in one of your key business metrics, is very commonly measured, and as is morale. The mention of using pulse surveys and engagement surveys, all of those tie directly to how you're measuring employee morale. So you are measuring those things today. So we're already seeing different tools that you can use for that. Next slide, please. Next, we're going to talk about a framework for well-being, and then I'm going to put this in context of how this framework can be used to look at a variety of different things that you can measure within your organization to be able to truly measure well-being. Next slide, please. This model may look familiar to many of you. It's adapted from the Gallup organization's well-being model. And I've changed a couple of the names here, but let me explain each of the elements. Energy, money, community, connect, and purpose. Next slide, please. With energy, think of this as your physical health. This is what traditionally wellness programs have been doing for decades, is we've been focusing on our physical health. I prefer to call it energy because it really is what helps feed our ability to be able to be productive citizens within our workplaces. So it's our physical activity, what we eat, how much sleep we get, not using tobacco, alcohol in moderation, and stress resilience or stress management. Next slide, please. Money has become such an important part of financial well-being, and yet this is the place where the employers play a critical role in their employees' lives. And not only through all the different benefits that you provide, but also through the resources that you make available from those benefits. But oftentimes we see that sometimes employees may be lacking some of the skills they need and the life skills to be able to manage money and those valuable benefits that you're providing. So things like budgeting, long-term planning, managing debt, having savings and goals, all of those are important elements to be able to make sure we have strong financial and money well-being. Next slide, please. Connect or connection is an important element. As human beings, we are meant to connect. And this is not just the relationships we have at work. These are relationships across our entire life. So family relationships, friends, the social interactions we have with colleagues. So being able to have healthy, loving relationships. This is a big part of what makes us the fascinating human beings that we are. Next slide, please. Community element is both the connection within the workplace, but also that connection in the community in which you live. Do you feel safe in your community? Do you have opportunities or take part in activities such as volunteering, where you have the opportunity to interact with others and give back to your community? and be able to have ways to express your shared values and interests. Next slide, please. And the last one is purpose. Purpose is what gets us out of bed and keeps us going every day. It's what gets us excited and gives us the passion in which we live each day. This is intrinsically motivated. This is what gives us the things that we're interested in and the motivation to really be able to contribute in our lives. And if you think about this in the corporate perspective, this is feeling connected to the purpose of an organization. This is something we hear a lot about the millennial generation, really not wanting just to have jobs, but they want jobs that they feel are making a contribution to a greater good. Next slide, please. So I want to talk about this model in the context of some work that I've done with several clients, and I'll show you one particular client here, and how we tied this back to measuring well-being. Next slide, please. The client I'm going to refer to here is a health insurance company. So they're a payer, and they have about 1,200 employees and are located in 4 New England states. When we were working with them, when I was working with them initially, we found that they had a lot of different program elements, but they weren't very well organized. They didn't have a strategic plan, and they had no framework around which they were delivering these programs. So we did an inventory of all of the different services that they had available, and they had a lot, just like many of you have a lot of different things available within your organization. And we put it under this framework so that we had a model by which to be able to talk about really all of the benefits that they were offering their employees. Next slide, please. So here's the umbrella. The way that we looked at this was our inventory of all of the different employee benefits. And you can easily do this. Again, make sure, whatever framework is right for you. Some of my clients have chosen environment to be one of the elements in this framework, or might combine connect and community. Whatever works for you is the important element of this. But you'll see under these pillars there are a variety of different programs. These are all of the different things that we took an inventory of and found that they were offering. Now notice that there were some energy programs. They had a wellness program. They had gym reimbursement. They had an EAP, member discounts, all of these different things that are available, either that you're offering directly or offer through your health plan. The money piece, obviously we have a lot of benefits that fall under here. Under connection, they had, again, EAP, where they could get support if they needed it, family days, employee committees, ERGs, different elements that help bring people together. Under community, this organization has a very, very strong community connection and a community foundation. So there's lots of local activities and participation that happens at the community level. And then as we looked at career growth and opportunity, which everyone wants in their career, we were able to inventory some of the different resources that were available to help people grow and develop in their careers. Next slide, please. What we then did was we identified all of the key metrics that might be available to us in each of these areas. So starting again at the left with energy, these are some of the typical places that you would be measuring well-being from some of the traditional wellness program perspectives. Participation, you might have a portal that you're using where you can get reports. You might be looking at workers' compensation claims or using questions from a health risk assessment or some sort of well-being assessment. Those might be the typical ones you're doing today. But again, does it tell us enough about the well-being of your workforce? The next piece is money. And here we've got a number of metrics that can indeed tell us about how people are thriving in their lives. So what percentage of employees are contributing to your retirement accounts? This is typically available from your human resources department or your benefits department. Percentage of employees contributing to health savings accounts, if you have those. The average percent of contribution to retirement accounts. the number of loans against retirement accounts. These are all different types of metrics that are available that can help us understand whether people are thriving or struggling. A number of years ago, I was working with a group of small businesses, and one of the human resource directors had noticed that a number of her employees were starting to take loans against their retirement accounts. So they were borrowing against their retirement savings to be able to live today. And she was very concerned about this because she saw an increase in this. And what she ended up doing was finding an appropriate solution that was going to help people learn to better manage their money for today so that they weren't using those loans. And it was very well received by her workforce. But she used that as an indicator to be able to know that people were having some difficulty. So you'll see across these, under connection, unpaid paid time off balances is a classic one to be able to look at to see if people are utilizing their time off to being able to get the rest they need to take breaks from work. Attendance at company social events. While that may not be a formal metric, it might be something that you can at least get a sense of. Under community, maybe you have a way of tracking volunteer benefit hours, and employees may get rewarded for that, or tracking United Way contributions, which often come through payroll deduction. So again, we're encouraging you to really look for some of these things to be able to know whether people are thriving in their lives. Under purpose, we have some of the common things we've already mentioned, like turnover, employee referrals, which is a metric that can be similar to the Net Promoter Score. Engagement surveys, you're already using those, so great job on those. Number of internal promotions and time to promotions, and use of continuing ed benefits. Any of these can help you as a way of measuring well-being. Next slide, please. So let's talk about a few other tools that you might be able to utilize in your workplace for measuring well-being. Next slide, please. This is one of my favorite tools, the Hero Health Scorecard. I mentioned this a little bit earlier with regard to some of the research that we had seen. And the Hero Health Scorecard is available from Hero Health. It's hero-health.org. And this is a best practices scorecard. One of the things I like about this is that it gives you benchmarking. So it benchmarks against U.S. companies. And it's also benchmarking against similar size organizations. It's really helpful because it's all based on best practices. It's a free tool, so there's no cost to do this. And when working with clients, we do this once a year. So we go in once a year, we answer all the questions on this, and it does take some time to do the research and gather the information on this, but it's worth it. And then we can see where we've made changes over time. And we can literally use this as a guide to say, where are we going to enhance our program? Where do we need to offer additional support or take different approaches? And if you're not already utilizing this, I would encourage you to explore this as a key metric because it is benchmarking you against similar size organizations. I often get asked about this in relationship to the CDC scorecard. And the CDC scorecard is another tool that can be used for this. However, the CDC scorecard typically tends to be, based on its origin with the Center for Disease Control and Prevention, more disease and condition focused, whereas this tool is more best practice focused. So I encourage you to use both. If you're going to choose one over the other, I would choose the best practice scorecard from Hero. Next slide, please. This is a list of some other tools that you may be able to utilize, and I want you to just see that there are a variety of different types of things available. So to the question earlier or the comment earlier that one of our participants shared is, you may be gathering information periodically, but you're not sure whether or not you're really having impact on the well-being of your workforce or really able to measure that. Some of these types of questionnaires and questions, if you embed these in surveys or in focus groups, you can utilize some of these to baseline the point from which you're starting and then be able to use those same questions to measure over time. Another one I use in addition to what is shown here is one called Cantrell's Ladder, which asks about life satisfaction. And it has responses can be categorized to thriving or struggling, so you can be able to really see and measure over time whether there's change. Let me just also mention in the middle of this table the behavioral risk factor surveillance system. This is standardized data that's collected across the entire U.S. Every state collects this data on a monthly basis, so every state reports on this. You can find your reports either through the CDC or from your local health department, your public health department in your state. If you do not have any data because you might be a small organization and you can't get reports with less than 50 employees, I often use this BRFSS data to be able to show a baseline of the general population. So, for example, if I'm working with a client and we determine that their workforce has 25% of their workforce is using tobacco, and we know that in the general population that 19% of the population is tobacco users, we can use that as a benchmarking number. So utilize these kinds of information as external credible resources in your way to create benchmarks. Next slide, please. This is a new piece that I came across when I was developing this material. I thought you might find this of interest. We can leave it to the British to be able to create a standard that can be recognized worldwide. And this is the British Standards Institute, BSI, has launched a new code of practice, which is called the PAS 3002, which is Code of Practice on Improving Health and Well-Being within an Organization. So this is intended to establish, promote, and maintain and review the health and well-being of workers. So it's a national measurement standard, and I would encourage you to research this as well. Again, it's always good to have some standards by which to measure. Next slide, please. So let's not overlook the fact that there are challenges in measuring well-being. So let's just explore this as a little, and we'll wrap up, and then we'll leave some time for some questions. Next slide, please. So what are the challenges we face when we're measuring well-being? I think this is one of the most frustrating ones for all of us, is finding the data. So where is the data? Oftentimes data might be in silos. I come across this often with working with clients. We often can get the internal data, but then when we try to get information maybe from a health plan or from a health risk assessment provider, we can't actually get the data that we want. We know the questions were asked, we know the data is available, but we can't get the level of data that we want. So this is where you may have to start to build relationships within your organization so that you can actually have people be part of your team and have them understand the reason you're asking for this data and how measuring change over time will help you really show the impact of your program and be able to show how that's impacting the business. Next slide, please. As with everything, collecting data and measuring is going to take time. And this is perhaps one of the reasons I see most often that people are not measuring well-being or measuring their program impact is they just don't make the time as part of their actual program calendar or their program year. So setting some benchmarks for yourself and milestones so that you can have your information available on a regular basis and know the timeline of which you're going to get it. When I'm, again, working with clients, it's not the kind of thing that's going to change every week. This is not a weekly activity. Sometimes we only get reports on some of the data that we're looking for once a year or twice a year. So we just set up our quarterly calendar, know what information we're going to get, and then at the end of each year, we prepare for our presentation to senior leadership on the impact and what we've measured as the result and where we're going for our next calendar year program. So make sure you devote the time and plan the time to be able to do this. Next slide, please. The other piece that's often challenging within measuring well-being is demonstrating causation. We know that there are many elements of things that happen in people's lives, there's behavior that changes, but it can be a long time before we sometimes see the result of that. This is why, especially looking at things like healthcare claims, when we look at those over a multiple year period of time, we really need to be looking at the long-term view. In working with a client last year, I returned to work with them after doing their strategy 6 years before, and as part of their assessment, I looked at their healthcare claims, and over the 5-year period of time since they'd started their program, their healthcare claims were flat. And while their head count had grown by 36%. When I presented that information to the Chief Human Resource Officer, I said, "Do you want to take credit for this with the wellness program?" To which she said, "Of course we will." They had no plan design changes, and they were able to keep those costs flat, which means they were keeping ahead of medical cost inflation. She absolutely wanted to take credit for that because they developed an award-winning program, and they felt that it was truly a reason that they were seeing such flat health care claims. But that's over the long term. So you really want to be taking a long-term view and see if you really can demonstrate causation. Next slide, please. So with that, I want to leave a few minutes for questions. I know we had a couple of good comments earlier, so I would encourage you to type your questions into the chat box in the lower left corner of your screen. Gina is here to help us with those. My contact information is here, and I'd love to have you connect on LinkedIn, reach out. And I post regularly with all kinds of information on topics related to not just measuring well-being, but all well-being and engagement and organizational and culture-related topics. So I'd love to have you reach out and connect. Gina, what do we have for questions?
Thank you, Mari. That was insightful. Let's see. So far we have, thank you so much for this presentation. Great food for thought. I made note of the 5 different areas of well-being. Is there one category that you have found is more popular with employees than another?
Mm-hmm. That's a really good question. Well, it's so interesting because our traditional wellness programs focus so much on physical health. And, how many apps I have on my phone that I use on behalf of clients with the challenges and all of the different elements. In many ways, it's easier to do physical types of programs because it's something that people can generally do easily. And when I ask in survey questions, I often ask, we always do an interest question, and one of the things that I see repeatedly that pops up to the top, the 2 things that come up most commonly are people wanting to become more physically active. They're always going to say that, if you had to choose between becoming more physically active, quitting smoking, or losing weight, which would you choose? So it's easy because people tend to do something like becoming more physically active because it's easier to do. But I'm also seeing financial well-being as now becoming much more prevalent on those interest surveys. And again, you have many resources in your workplace, such as the provider of your 401k or your administrator 401k often provides resources or lunch and learns or brings counselors on site. Your EAP may be another resource for some of those kinds of things. But we tend to also default to the challenges and the types of programs around physical well-being because they also lend themselves so well to social engagement, where we can build teams around these kinds of activities. And that team element goes to the connection dimension of the well-being model, where we want to be bringing people together so that we can create those social connections and that interaction and those ways of getting people to bond around something other than just their work. So you can utilize it to be able to to really carry out some of these other dimensions of well-being? Great question. Thanks for asking that. Other questions?
We have one more question.
Sure.
How do you use the HEROES measurement tool?
Great question. The HEROES scorecard has, I'm going to do this off the top of my head, I want to say 6 dimensions. And each of those dimensions is going to give you a score. So let's say one of the dimensions is senior leadership support. Keep in mind it's based on best practices. And within the scorecard, it's going to give you, let's say there's 12 questions about the elements of senior leadership support that you're utilizing in your organization. So if your score is low there, you can go back to those best practice questions and you can look at those and you can actually say, okay, where do we need to do more work in this area, or where do we need to improve? And you can really use it as a guide. I quite literally use this to help set goals and objectives with my clients, is we go through and we look at places where we say, all right, we need to focus more on this particular dimension and therefore improve our score. And sometimes that's going to take a while, because it might be that you had changes in your senior leadership team and now you've got to go sell well-being to some new senior leader. Sometimes these things take time, so you have to build them into your program. You need to build them into the way you're communicating. And I love this tool because it literally gives you, if you just follow the elements of this and then make changes year after year, your score is going to improve. And that's exactly what we've seen with our clients, and we use this. We also participate in some award ceremony, competition types of things where they use the HEROES scorecard as the basis for that. And so we follow it very closely to be able to make sure that we're improving year over year. Really good questions. Thanks.
Thank you, Mari. I want to thank you for everything you did for us today, and I want to thank all the participants who logged on today. Remember that you will be receiving a SurveyMonkey evaluation in your email later this afternoon or tomorrow morning. This will be the only way you're going to receive your SHRM and HRCI credits. Again, thank you all for participating. Have a wonderful afternoon.
Thanks, Gina.
That does conclude the conference call for today. We thank you for your participation, and you can now disconnect your lines.